If you recognize any of these 7 symptoms, you could be just days away from a heart attack. See a cardiologist immediately. Every second counts. Saying I was shocked is an understatement. I'm on high alert. In recent years, heart attack cases have skyrocketed, even among people under 40 and women. Let's understand together why this situation is getting worse and what's causing so many young people, even those with no history of heart issues, to suffer sudden heart attacks. Subscribe to the channel, turn on notifications, and share this video with someone you love. Today, we're going to reveal it all. I want to hear your opinion. According to international organizations, heart disease claims more than 17 million lives each year. That's over 30 deaths per minute. Not even cancer or traffic accidents cause that much damage. The biggest issue is that these diseases act silently and are only noticed when the damage is already done. That happens because the signs our bodies give days or even weeks before a heart attack aren't clearly taught to the public. That's what I want to change right now. I'm going to show you the 7 main warning signs the body gives before a heart attack. Sometimes they appear weeks before, other times just days. Many refer to this as a pre-heart attack or silent heart attack. And at the end of the video, I'll reveal what's behind heart attacks in people under 40. The heart is a vital pump that sends oxygen-rich blood throughout the body, even to itself. The coronary arteries are the vessels that nourish the heart muscle and keep it functioning. A heart attack, or acute coronary syndrome, happens when this blood flow is interrupted. This occurs due to blockages caused by fat buildup, calcium, or inflammation in the artery walls, preventing blood from circulating. The main culprit? Atherosclerosis. This silent villain forms fatty and inflammatory plaques over the years, without clear symptoms. And when the blockage reaches a critical point, the result can be fatal. But the most dangerous part is that even without complete blockage, these plaques can rupture and cause clots. When that happens, the clot blocks the artery and the heart attack begins. However, the body may give warning signs before the collapse. This is what we call a pre-heart attack. The heart's blood supply is compromised, but hasn't yet caused muscle tissue death. These symptoms can appear after stress, scares, arguments, intense exercise, sleepless nights, anything that speeds up your heartbeat. They can show up at any time, and not always with the classic chest pain. That's why you need to know each of the signs I'll list now. The first symptom is very common among women and the elderly: digestive discomfort. It might feel like simple gastritis, but it's not. A sensation of a full stomach, burning after meals, or abdominal pain when walking or exerting yourself should trigger a warning. This is especially important if you have risk factors. The main ones are age over 50, although now the risk extends to younger people, diabetes, high blood pressure, obesity, excess abdominal fat, smoking or exposure to cigarette smoke. In many patients we see after a heart attack, the story is the same. Days before, they felt pressure or burning in the stomach, thought it was something minor, took antacids, but the symptoms persisted. So be alert. Detecting it early can save your life. The second sign: unusual fatigue and shortness of breath. About 70% of women who had a heart attack felt this days or hours before. No fever, cough, or sore throat. It just feels like unexplained flu. It's sudden muscle fatigue with no clear reason. If in recent days you found it hard to walk a block, climb stairs, or feel exhausted with little effort, be cautious. It could be a sign of clogged arteries, even without chest pain. But how do you distinguish it from anemia, inactivity, or respiratory problems like bronchitis? You should be suspicious if the symptom is new, getting worse, and especially if it comes with risk factors or other signs I'll describe in this video. Stay with me. Sign number 3, jaw pain. That's right. Just as leg pain can mean spinal issues, jaw pain, especially on the left side, could be a sign of heart distress. This happens because during fetal development, the nerves cross over, and in adults, the brain can misinterpret the source of pain. The heart is suffering, but the brain thinks it's the jaw. Confusing? Maybe, but it's real. So if this pain is new, has no explanation, and comes with discomfort, go see a doctor. If the jaw pain is new, intense, and comes with other cardiac symptoms, don't wait. See a specialist immediately. Fourth sign, cold sweat and sudden paleness. This isn't sweat from heat or exercise. It's sticky, cold, and appears out of nowhere. It might be on your forehead, hands, or all over your body, and is often accompanied by sudden paleness. This kind of sweating can happen while resting, after a meal, or randomly, and it usually happens multiple times before a heart attack strikes. The fifth sign is back pain, especially between the shoulder blades or at the base of the neck on the left side. In my career, I've seen many people mistake this for muscle pain. But if the pain doesn't improve with a change in position or massage, be on alert. Sometimes the issue lies in the aorta, the body's largest artery, which can develop lesions or dilations, causing intense pain between the shoulder blades. Pre-heart attack pain, however, is milder, like pressure. It comes and goes, but if it's new and unexplained, it could be cardiac. And if, along with the back pain, you feel shortness of breath, discomfort, or another symptom from this list, seek urgent help. Sign number 6, numbness or mild pain in the left arm and hand. If this occurs while walking or climbing stairs, and it's never happened before, it's a cause for concern. Sure, it could be something else like muscle or nerve issues. But if it's a recent symptom and you have risk factors, consult a cardiologist to rule out anything serious. Don't wait for it to get worse. Heart attacks rarely give a second warning. Seventh and final sign, sudden dizziness, feeling faint, or unexpected drops in blood pressure. This can happen during light activities like walking, climbing stairs, or even eating. Many patients who reported these symptoms were diagnosed with almost total artery blockage. Tests like catheterization confirm it. But how can you tell if it was a pre-heart attack or a silent one? Sometimes it's hard. That's why if you've experienced any of these 7 signs in the last 30 days, see your doctor as soon as possible. This is even more urgent if the symptoms happen more than once, especially if you're a woman, have diabetes, are sedentary, smoke, or have high blood pressure. And attention, even if you're young, the risk of a heart attack is real. Take care of your body. Second step, exercise. Physical activity strengthens the heart, improves circulation, and helps maintain a healthy weight. Walking, swimming, cycling, or running for at least 150 minutes a week makes a difference. Strength training is also important to keep muscles active. Third tip, manage stress. Chronic stress is a silent killer. Techniques like meditation, deep breathing, yoga, and mindfulness help reduce cortisol, the stress hormone, and regulate blood pressure. Taking care of your mind is just as essential as caring for your body. Fourth tip, get quality sleep. Sleeping well regulates blood pressure, reduces the risk of obesity and diabetes, and protects your heart. Aim for 7 to 8 hours per night. Create a dark, quiet environment with no screens or stimulation before bed. Fifth habit, say no to smoking. Quitting smoking is the best gift you can give your heart. Tobacco damages arteries, increases blood pressure, and lowers oxygen in the blood. If you need help quitting, seek professional support. Sixth recommendation, moderate alcohol intake. Excessive drinking raises blood pressure and can lead to heart failure. The ideal intake is up to 1 drink per day for women and 2 for men. Prefer red wine, which contains antioxidants like resveratrol, beneficial for the heart. Lastly, get regular checkups. Monitoring blood pressure, cholesterol, and glucose is essential to detect any issues early. Always talk to your doctor and know your numbers. Understanding your risks is the foundation of prevention. Adopting these 7 habits can transform your cardiovascular health and elevate your quality of life. Prevention is more effective than any medicine. Start taking care of your heart today and be inspired to live in a lighter, healthier, and more balanced way. And now, a controversial topic many have asked about: heart attacks and COVID-19 vaccination. What do we know so far? Vaccines were a major breakthrough in fighting the pandemic, but concerns have also emerged about possible long-term effects. It's true that, given the global urgency, trials were accelerated. Normally, such studies take years. With COVID, everything was done at record speed. This allowed fast access, but left some uncertainty about rare effects that may appear over time. The trials were robust, with thousands of participants. Even so, no study can predict every possible future scenario. That's why a margin of uncertainty exists, which is normal for any new medical intervention. Science continues to study, and vigilance remains high. Organizations like WHO and the CDC maintain strict monitoring and update guidelines as new information emerges. If you have questions or concerns, speak with a healthcare professional. They can guide you based on the latest guidelines and your medical history. Subscribe to the channel, turn on notifications, and share this video with someone you love. Medicine is constantly evolving. What matters most is having reliable information and making decisions with expert support. Vaccination remains a powerful tool to save lives, and the benefits outweigh the risks for the vast majority of people. If you've watched this far, leave a comment. Gratitude is medicine. I'll stop by to personally thank you and answer your questions. And don't forget to watch the recommended videos on the channel. There's a lot of amazing content that will surprise you. See you next one.